call is Gloria Madonsela. She's our administrator, and most of you would have had interaction with her at some point for any of your admin or claim queries. Please note, microphone functionality has been disabled for this call to limit interference. You can post your questions into the chat box, and at the end of the presentation, we will enable microphones if you'd prefer to ask them verbally. The session will take about 45 minutes. We are asking that members do submit their plan upgrade choices by the 30th of November 2023, because we at BDO are closing on the 14th of December, and we just want to ensure that there is timeliest processing of your upgrade requests. Discovery will allow you to do upgrades up until the end of December, but at BDO we're closing on the 14th, and that's why we set the date to the 30th. Discovery's core purpose is to make people healthier, enhance, and protect their lives. We will be discussing these 4 topics over the next 45 minutes. That is the financial strength and sustainability of the scheme, affordability and flexibility across plan ranges, the benefits and extensive networks, and the service experience for customers. The first topic. Discovery is in a very strong financial position. On the right, you can see their solvency is 30% in reserves, which is 4.4% above the legislative South African requirements. So the scheme is in a very good position to address your medical needs. DHMS or Discovery remain the largest open medical scheme in South Africa with just under 60% of the market share. The membership base remains solid with low lapse rates and few plan changes. On to the second topic, we'll discuss the affordability and flexibility of plans across the scheme. Discovery offer 22 plans which are tailored to suit medical and financial needs at different levels. They have a various variety of plans to choose from, which meet the various needs and budgets. When comparing Discovery to the next 7 largest open schemes in South Africa, you will note Discovery is either on par in pricing or cheaper when looking at the limited day-to-day options, such as the Saver Series or Smart Series, and cheaper still when comparing to plans in the extensive day-to-day range, such as the comprehensive and executive plans. Contributions in 2024 increased based on risk factors, medical inflation, and plan utilization. That is how Discovery arrived at the risk contribution increase across the various plan types. You can see the risk contribution increases vary between 8.9% to 12.9%. It's not a flat rate across the board. The weighted average fee increase for 2024 is 7.5%. This slide illustrates the various plans Discovery offer and where they fall in from a price point. Top to bottom is most comprehensive plans like Executive and Comprehensive through to Priority, Saver, and Smart, which offer limited day-to-day benefits. Following through to Core, which is a hospital-only plan, and Key Care targeted at the lower income markets. As mentioned, they offer 22 plans to suit various medical needs and price points. Please note the reduced options under the comprehensive series, which we will unpack soon. Effectively, in 2024, the comprehensive series will comprise of 2 options, which is the Classic Comprehensive and the Classic Smart Comprehensive. During October, Discovery sent out communications to members to inform them of the changes of these plans. Members on the Delta essential comprehensive plans received a very specific letter informing them that their plan will no longer be available from the 1st of January 2024 and asking them to choose an alternative plan. Please ensure that the plan changes are made before the 31st of December 2023 if you do decide to deal with Discovery and not us for your plan changes. And members who were impacted by this comprehensive series adjustment actually have until the 31st of March 2024 to make a plan change. That includes the option to upgrade their plan choice, but that is only relevant to members who were impacted by the consolidation of the comprehensive series. In terms of the Classic Smart Comprehensive Plan, it's a small option today with less than 500 lives on it. Discovery have enhanced the Classic Smart Comprehensive Plan and have included a medical savings account. The reason for the addition of the medical savings account is so they could devise a home for the essential comprehensive members whose plans have been removed. So they added in a 15% MSA or medical savings account and took the decision to retain the risk-funded GP consultations with a 65 Rand smart co-payment. Two other changes on the Classic Comprehensive Plan is that there was also the introduction of the fair usage limit on the above threshold benefit. When you see the distribution of claims on this plan, it becomes apparent why it is necessary. For a family of 4 on the Classic Comprehensive, the above threshold benefit fair usage limit is 87,000 Rand, which is quite sufficient to cover day-to-day healthcare expenses over and above the MSA and the self-payment gap for a family of 4. Discovery do still maintain the extended benefit on the allied and therapeutic, which are unaffected by this change, and this will allow them to sustain and maintain the benefits going forward. The second change that we have made is the ability to manage the cost of the oncology innovation benefits. In 2019, Discovery introduced the oncology innovation benefit in response to the high and very expensive drugs introduced into the market for the treatment of cancer, simply being unaffordable on the managed normal oncology benefits. What they're doing is maintaining the oncology innovation benefit with a 25% co-payment as the standard co-payment for the treatment from the oncology innovation benefit. But for certain named drugs, the co-payment increases to 50%. So for a few of these high-cost name drugs that is covered by the oncology innovation benefit, the co-payment will increase from 25 to 50%. This will be introduced from the 1st of January, and any members that are currently covered on this oncology innovation benefit will continue as normal and will only apply for new treatment plans approved after 1 January 2024. They are grandfathering the cover that members currently have from that benefit, and over time will work with the manufacturers to leverage the benefit by trying to get them to bring their prices in line with a place where Discovery can levy a 25 co-payment instead of the 50% co-payment. In 2023 and 2024, Discovery introduced the Wealth Fund. This was an additional once-off savings that they gave to all Discovery members, Discovery Health members. You did not need to activate it. It was awarded seamlessly and used before your savings were used. Even core, smart, and key care members received this, and it was based on your family composition. Just remember it was a once-off. So if you used it in 2023, then it's not available to you again in 2024. But if you joined now or you're joining next year, then you will have that benefit. But if someone joins in 2025, that benefit no longer exists. The third topic will unpack the benefits and extensive networks of Discovery. An interesting slide that highlights the top 10 highest claims over the past 12 months. These claims totaled 53 million Rand. This talks about the need to belong to a scheme with sufficient reserves. Unpacking the hospital benefit or the risk benefit, as it is also known. Discovery cover unlimited hospital admissions. You always need to obtain authorization for planned procedures. Specialists, where there is a payment arrangement with Discovery, are covered in full. Essential and coastal plans cover at 100% of the Discovery health rate. Classic covers at 200% of the Discovery health rate. Executive at 300% of the Discovery health rates. There are 4 network options, and those are Delta, Smart, KeyCare, and Coastal. In emergencies, you are covered in full, even if you are on a network option. An emergency is the sudden and unexpected onset of a health condition that requires immediate medical or surgical treatment, where failure to provide treatment would result in serious impairment to bodily functions. Note what Discovery pay for: the ambulance, hospital account, admitting doctor account, anaesthetist, and any other approved healthcare providers. You can save the number in the middle of the screen for your emergencies if you don't have it saved already. If you don't have the Discovery app, you should download it. It has a handy tool like Find a Provider to find full cover options with contracted providers. Where providers are not contracted, i.e. they charge above the scheme rate, the right table will apply. So if we look at that example, Dr. Frank, an anaesthetist, charges 10,000 Rand for procedure. The Discovery health rate is 5,000 Rand. Dr. Frank therefore charges 200% of the Discovery health rate. Here is where the importance of a good gap cover comes in. If you don't have a gap cover and would like to sign up for one, you can send an email to the admin box, which is bdo.healthcare@bdo.co.za, and we can assist you. Gap cover price ranges from 200 to 800 Rand, depending on the plan and family composition and age. Gloria, if you could please post that into the chat box. So how do the network plans work? They're selected based on clinical qualifying metrics, availability and a range of healthcare services and facilities, efficiency metrics, participation of specialists in the Discovery Health payment arrangements, and accessibility to the membership base. You can scan the QR code using your camera on your phone to view the Discovery Health network list. By opting for a network option, you can save up to 20% in contributions. Please take note of the chronic disease list. Remember, because you take a medicine chronically, it does not make it a chronic condition. These are the 27 conditions covered on all plans. Those are the conditions on the left: Addison's, bipolar, diabetes, epilepsy. Then in the right, in the black box, there are the additional conditions covered only on comprehensive and executive plans. You must register your chronic condition by completing the chronic illness benefit form and returning it to BDO Healthcare at bdo.co.za. Your doctor completes this with you. You cannot complete it on your own. Accessing your medicine can be done through the pharmacy network if you are on the executive and comprehensive plans, or via MedExpress for all other plans except KeyCare. You can use the Discovery app to order medicines and track the status of delivery. When it comes to screening and prevention is better than cure. Screening and prevention benefits are available to all members on the Discovery Health Medical Scheme and vary per age category. So different ages will access different screening and prevention benefits. These are paid for from your risk and they are subject to limitations. For example, a pap smear may be done every 3 years. Maternity benefits may differ per plan. This is an overview of the benefits during pregnancy, after birth, and for pre and postnatal care. Remember, assisted reproductive care like IVF are only available on the executive and comprehensive plans. Unused savings are carried over to the following year. On Saver Series and above, once your savings finish, you can access the day-to-day extender benefits, which are funded from your risk benefits. These provide access to nurse consultations, GP consultations when referred to, and 2 kids casualty visits. We're going to unpack the wealth fund. Going back to the wealth fund, which I referred to earlier, up to 10,000 Rand was given in discretionary wellness benefits, which is available from the 1st of January 2024 for 12 months. This is determined by the family composition. Remember, this was once off, so if you finished it this year, then it's done. This table shows the allocation of the Rand value per your family composition. So if you are a single adult member, your wealth fund was equivalent to 2,500. The wealth fund can be used for a range of additional screening, monitoring, and prevention benefits, or it could have been used simply to see your GP. It wasn't prescriptive. You could have used it wherever you wanted to within the realm of medical spending. Looking now at the additional benefits to enhance cover, there are various care programs where members' quality, like the cancer cover, chronic and conservative care programs, care at home and virtual benefits have been enhanced and personal health pathways have been introduced. We will unpack those in a few slides' time, but for now we'll unpack the oncology benefit a bit further. Discovery offer comprehensive cancer cover. Unfortunately, there is a rise of cancer diagnoses. Please ensure you are enrolled on the oncology care program if it does apply to you to unlock the basket of care for oncology benefits. Here you can compare the oncology cover across the plan ranges. The innovation benefit is not available on the key care plans. Key care plans are covered more in line with the prescribed minimum benefits of care level. The other plans have additional benefits for oncology added to them. As we know, artificial intelligence is taking over, and this is in the healthcare space too. A lot of time and focus has gone into enhancing digital care and enhancing the use of AI. Predictive modeling is now used to identify members at risk or of cardiometabolic syndrome. These are based on a unique insight, which is obtained when you do your health check. At-risk members have a basket of care that would be funded from risk, not from savings. Risk means that the scheme will pay for it and you don't pay for it from your pocket. And once they also access this basket of care, they can be managed on an ongoing basis to ensure that they are remaining in an acceptable level of risk. Here are the chronic care programs for affected members that they can sign up for. There's the mental health care program, the diabetes care program, the cardio care program, and the HIV care program. On the Discovery app, you can now also track your health. So when you go for your healthcare assessment, those metrics that you've done will appear in your Discovery Health app. And if you are in Vitality on that program, these are the points that would count towards obtaining a higher point status for the following year. You will note, just looking at the diabetes care program, here you can see why you would want to enroll in it, because you get additional benefits that become unlocked. For example, additional glucometer strips, consultations with a dietitian, the biokineticist. You can also have a nurse educator to assist in your day-to-day management of your condition. And each program has its own basket of care that becomes applicable to you. Conservative treatment for back and neck is much more favorable. And so this conservative approach is being encouraged rather than slice and dice you. They encourage you to first go for out of hospital treatments, seeing your physio, your bio, etc., because it's more conservative than going under the knife. In 2024, they will be introducing the home-based hospital network. This applies to members on KeyCare, Smart, and Delta only. And it only applies to low acuity conditions, that is, less urgent conditions such as pneumonia or urinary tract infection, asthma, deep vein thrombosis, to name a few. You can see them on the left of the slide. Members must be eligible to use home care. They must have support, family support that is, access to clean water, and a solid supply of power. I know Eskom makes that difficult, which is why Discovery has come in with the idea of installing a backup USP power whenever a patient is admitted to their home for home care. They supply the data so the doctors can monitor the patients 24/7 and respond if there is an emergency. They have not seen any issues, and no patient's care has been compromised in any of the cases which were studied when treated through hospital at home to date. To date, 100 doctors have signed up that will actively admit patients to their homes for treatment if they are eligible for it. The reasons behind this introduction was to drive down the costs of admissions, as well as to give members a more comfortable space if they didn't want to be treated in hospital. 3 other virtual benefits in 2024. The first is speak to your doctor now. This is a functionality. The functionality is really there to give members a convenient alternative than to go to their GP, as well as enable members after hours when they maybe had a full day of work and were unable to get to a GP during the day. It gives members a full end-to-end journey from the ability to check their symptoms, speak to a doctor within minutes, and after their assessment and diagnosis, the doctors can prescribe medication and members can complete the journey by ordering medication and have it delivered to their home. Doctors can also refer you to the casualty or emergency care if you require it. Note, this is for urgent care. Urgent care is typically defined as treatment of conditions that are not medical emergencies, but require attention within 24 hours, like constipation, minor cuts and burns, eye irritation and redness, or bronchitis, to name but a few. For any urgent care within 24 hours, members will have access to risk funding benefits. Members have access to 4 risk-funded consultations per family per year. Key care members have access to 1 consultation per year. In the case where it is urgent care, consults will be funded from risk, and where it was not, consults will be funded from members' day-to-day benefits or self-funded. Any follow-ups, prescribed medication, or referrals will be funded from the members' day-to-day benefits. The second benefit is virtual physical therapy. This is designed to be in conjunction with normal in-person consultations with the physio or bio. Usually when you see a physio, they prescribe an exercise program, which most people don't do or probably find it difficult to maintain the form to get the most out of the exercise. This benefit is designed to complement the in-person consultations to a physio. These benefits will also be funded from members' available day-to-day benefits. This is in partnership with Genie Health. Members would be required to visit one of the providers within the network to access the platform and enroll. It's funded from members' day-to-day, including savings above threshold and allied and therapeutic benefits. The sessions can range from 375 Rand for an initial assessment and a follow-up session for 200 Rand each. So you can see they are quite a bit cheaper than in-person sessions. Lastly, the third benefit introduced is digital therapeutics for depression. Digital therapeutics is not limited to mental health conditions, but the vast majority of digital therapeutics are used for mental health. Digital therapeutics is a new treatment class that needs to be prescribed by a healthcare provider. The increase in prevalence for mental conditions for both globally and South Africa are very few people get the required treatment to manage these conditions. Discovery have a full end-to-end journey for members living with mental health conditions or who have an episodic nature of mental health conditions. With this new mental health assessment, this is Discovery's way of proactively trying to see which members are at risk of a mental health condition. It's quite important because in the absence of this proactive approach, they would rely on the member to go to a provider, be diagnosed, and get treated. From 2024, all Discovery Health members will have access to this mental well-being assessment that lives within the Discovery Health app. Once a member completes this assessment, based on their outcomes, together with the clinical data based on their claims, Discovery can evaluate the member risks. Based on these risks, members can be given risk-funded benefits. So members with moderate risk will receive proactive virtual risk-funded benefits, such as coaching and GP consults. For members with severe risk, they will receive proactive virtual coaching and risk-funded virtual or face-to-face consultations with a GP or psychologist. Care coordination by a single primary care GP improves healthcare outcomes. The world is moving in a direction where we're saying that care should be coordinated by a single primary healthcare provider. The benefit that this delivers are fewer visits to casualty, better mortality outcomes, better morbidity outcomes, higher likelihood of complying with treatment protocols that have been assigned, and Discovery have seen in their data more than a third of members living with a chronic illness see a single healthcare provider already. So a higher compliance with treatment and lower admission rates are truly the benefits of this single coordination. So they're going to make this a requirement for all members on all plans, with an exception for the executive plan from the 1st of January 2024, that you must nominate a primary GP for the treatment of your chronic illness. Chronic illness being those 27 conditions from the previous slides. An important principle here is that they want a chronic member to go back to their GP in order for them to manage and coordinate their care, in order for them to get to a better and healthier place. Given the feedback that was received from last year from planners, brokers, members, and doctors, Discovery have invested a lot of time in making sure that the network is accessible. 77% of members already see a network GP regularly, so it shouldn't be an issue for the bulk of members to nominate a GP, given that they already see them over and over. There are already 4,600 GPs contracted, and 95% of members have a GP within an 8-kilometer radius of them. So they don't foresee a problem for members to nominate a GP and see them for the coordination of the care. Discovery created a very simple nomination process on the New Health app that a person can go through to nominate their primary GP. Please scan the QR code to get the latest version of the app. You can do this by opening the camera on your phone, and once you hover it over that little barcode, there'll be a little link that you can click on and it'll take you to download the app. Or you can search for the Discovery Health app in your app store. These are the features that are available on the app, so it really is quite important to get. You can check your symptoms. Um, there's a little artificial intelligence man that pops up, and you can tap the head to say you have a headache, and it can tell you what are your potential causes of this headache, and then it can refer you to see a doctor or an online doctor. There's the online pharmacy. You can manage your plan, access your claims, view your claims. The personal health care nudges will be introduced from next year. For example, if you carrying some fluff from the December holidays and need to shed it, and now you're a bit overweight, there's actually a little personalized platform that will say, check in with the dietitian and you get points and awards for meeting those personal goals that it gives you. You can access emergency assistance and services through the app. You can access the virtual urgent care, which we discussed earlier, which is 24/7, the virtual physical therapy, and the digital mental health. And with that, those are the updates for 2024. We will take questions now. Tilani, if you could please allow the microphone function. If you don't want to ask over your microphone, you are welcome to post it in the chat box. Okay, it doesn't look like we have any questions in the session. The session has
Yeah, no questions on the chat as well, T.
Okay, thank you, Gloria. This session has been recorded and will be distributed later this week. So thank you very much, everyone, for joining me. I wish you all the best with the last push of the year. And please do remember to send any plan changes in writing to BDO Healthcare at bdo.co.za by no later than the 30th of November. Have a good day.
Thanks, everyone.